Everyone, welcome to this Senate Committee on Healthcare and Human Services. It is April 9th, and I'm going to rearrange the agenda. We're going to start with Senate Bill 806. I'd like to open a public hearing on 806, and Sandy.
Madam Chair, members of the committee, Senate Bill 806 is at the request of the good chair. The bill is authorizing individual licensed to practice medicine or podiatry in another state or country to provide healthcare services for out-of-state athletic team under certain circumstances. Madam Chair, members of the committee, should the committee choose, we do have a fiscal statement, which is a minimal expenditure impact statement and a no revenue impact. And there are no amendments that I'm aware of.
Nor will there be. So that's the good chair. Who would be the bad chair is what I want to know. But
anyway. I'm going to refrain from commenting on that one.
Thank you,
Vice Chair.
Vice Chair and members of the committee. I'm State Senator Lori Monis Anderson. I represent Gresham, Troutdale, Wood Village, and Fairview. And I'm here bringing Senate Bill 806 to you. It was the American Medical Society for Sports Medicine actually came up with this concept. They are working on this and have passed this bill in several other states, many other states. Basically, 17 states recognize a medical practice exemption for physicians who travel into a state with an athletic team solely to provide care for that team. And for team physicians who travel into multiple states, obtaining and maintaining licensure in each state under a scenario where they are not even providing medical care to residents of the state, that constitutes an excessively high administrative cost and risk management burden. So basically, this bill would amend the language of the State Medical Practices Act to include an exemption from licensing requirements for team physicians. And I have two physicians on my right and on my left who will tell you why we should pass this bill. Thank you, Mr. Chair, Vice Chair, and members of the committee, and I will let the two physicians take over.
So, my name is Dr. Doug Ackerman, and I'm a physician in Corvallis, Oregon, and team physician at Oregon State. Chair and committee members, thank you for taking time to listen to us. So it is important for physicians who are team physicians to be able to travel with the athletes that they provide care for. And when they cross state lines, they are essentially practicing without a medical license in that state, which is difficult to do if you end up having to get a state license or a temporary license in every state that you would then be traveling to with your team. I traveled with Penn State for several years and actually did go through the process of getting state licenses in different states, and it cost me about $10,000 a year to be in each individual state no more than 4 days. And it is an excessive burden. The 20 states, including California and Washington, have passed this resolution, and I think it is important for the state of Oregon to also be on that same page for physicians that are traveling with their teams into the state.
Barry Rhodes. I'm a family practice sports medicine physician in Milwaukee, Oregon at Northwest Primary Care. Thank you, committee and Madam Chairman, for hearing my testimony. I'm a member of the AMSSM, American Medical Society for Sports Medicine, and I am giving written testimony in lieu of their transmitted testimony. I strongly support this bill. I have in the past traveled across state lines with collegiate athletics. I feel that a traveling physician, a team physician, excuse me, serves a very important role. They are there to safeguard the health and safety of the athletes, and having spent time with the players and coaches, I believe they are the best positioned to provide treatment and make decisions regarding their health. Right now, there's a patchwork of laws governing traveling physician practice. As Dr. Ackerman said, there are many states that do have an exemption for traveling team physicians, including California and Washington. It would be unreasonable and a burden to try and require physicians to obtain medical licenses in every state that they would go to. This is especially a burden if you were traveling with a collegiate team and were going to a certain bowl or NCAA tournament, for example, into a state in which you had no previous knowledge that you would be going to just a week before. I like the bill in that in emergency situations, a licensed physician of Oregon would be required, and this does not affect the public in any way, as the licensed physician would not, as the physician traveling with the team would not treat anyone but the members of the team and immediate family who are not residences of the state of Oregon. And although this does not directly affect me, as I am licensed in the state of Oregon, I think that it is important to look out for our brethren in other states. Oh, thank you very much.
Thank you. Yes, Senator Cruz.
My only question, because it's for 10 days, is that enough time to cover like Olympic trials and stuff like that? Because I'm thinking the athletes are going to be here, you know, because Olympic trials happen in Eugene a lot. And I'm just wondering if it's a broad enough window, they come in ahead of time, and the trials themselves can almost last that long.
Right. There is a provision in the bill to allow for a 21-day permission with request from the board.
No, I saw that. Is that an onerous thing to have to go through, or is that?
It is a step, but if you are going to be covering the Olympic trials in track and field, you have enough lead time, as opposed to, you know, any school coming here to spend 3 or 4 days and then leave.
Right. I mean, for most things, that's fine. The Olympic trials kind of popped up for me, and so, okay.
I think it's difficult if you make it too long of a time, then I think the state board's going to object.
Right. Okay.
Senator Steiner Hayward.
Thank you, Madam Chair. I don't know if you gentlemen know, but I'm a physician as well, and I really support this bill, and I think it's a good idea, and it's very congruent with other bills that we're doing this session to remove unreasonable licensure requirements for professionals coming from other states. I mean, we're doing it for people who do makeup and hair for the film industry, and they're coming in for a very specific purpose to serve a very specific population, just as team physicians are doing. This is really more commentary. I think it's a great bill, and I'm very glad that it's here and really support it. So
thank you.
It's a good bill.
Any other comments? And this is the only people that were signed up.
Then let's move it.
Okay, I'll close the public hearing on Senate Bill 806 and open a work session on Senate Bill 806.
Madam Chair, I move Senate Bill 806 to the Senate floor with a due pass recommendation.
Senator Cruz moves Senate Bill 806 to the floor with a due pass recommendation. Is there any discussion? Clerk will call the roll.
Senator Steiner Hayward.
Aye.
Senator Knapp.
Aye.
Senator Shields.
Aye.
Vice Chair Cruz.
Aye.
Chair Monson.
Aye. Motion carries. I'll close the public hearing.
And you will carry the bill.
Pardon? Oh, I'll close the work session, sorry, on Senate Bill 806. And I will carry the bill. And thank you, gentlemen, very much.
Thank you.
Thank you.
Have you given her? Okay, I'm going to open a work session on Senate Bill 490. Sandy, bring us up to date.
Madam Chair, members of the committee, we had the public hearing on Senate Bill 490 on the 1st of April, which requires an entity advertising and providing specified health services to provide notices and disclosures about the nature of the services. This relates to the crisis pregnancy centers, Madam Chair, and we do have a fiscal and a revenue. Yeah.
So should we move dash ones?
Yeah. Okay.
Okay. Madam Chair, I move Senate Bill.
No.
Move that oh, okay. Sorry. I move to adopt the dash one amendments dated April 3rd, 2013 for Senate Bill 490.
Senator Steiner Hayward moves to adopt the dash one amendments into Senate Bill 490. Is there any discussion? Is there any opposition? Mellow Clerk should call the roll on that.
Senator Steiner Hayward.
Aye.
Senator Knapp.
No.
Senator Shields.
Aye.
Vice Chair Cruz.
No.
Chair Monson.
Aye. Motion is adopted.
Madam Chair, I move Senate Bill 490 with the dash one amendments without recommendation to the Senate Committee on Rules.
Senator Steiner Hayward moves Senate Bill 490 as amended to the committee, without recommendation to the Senate Committee on Rules. Is there any discussion?
Yeah, Madam Chair.
Yes.
Yeah, like you, I received a couple of letters
regarding legal analysis of this bill. And both these letters basically indicate that they believe it's unconstitutional and that that they would likely sue if the bill was enacted into law. And I think we heard in testimony that the lawsuits in other jurisdictions were successful. And I don't see any reason for this bill to go forward, so I'll be a no.
Thank you. Yes, Senator Cruz.
Thank you, Madam Chair, for a lot of the same reasons as Senator Knopp. And we have seen this sort of legislation over and over and over again. And quite honestly, Madam Chair, for attacks like this on institutions like this that do such good work, I find incredibly offensive. And I would prefer that we keep the bill here in this committee and kill it.
Any other discussion? Okay, we are in work session, right? Yeah. Clerk will call the roll.
Senator Hayward.
Aye.
Senator Knopp.
No.
Senator Shields.
Aye.
Vice Chair Cruz.
No.
Chair Montesino.
Aye. Motion carries, and this bill is being sent to rules. I will close the work session on Senate Bill 490 and open a public hearing on, we don't have Boquist or, so we,
Oh, do we have the senator out front? Yeah, you can go. That would be great. Thank you.
Yeah.
Thank you for
Thanks.
coming.
You've got
It's important for Senator Hayward to see these people. Very.
What are we doing?
4 and 823.
Simultaneously?
Did you open both of them together or just?
No, I haven't opened anything.
We're doing 823 or 4 or which?
Should I do both of them?
Well, probably not, because
No.
823, yeah, just let's do 823. They are a package deal, but,
Are we just doing 823 now?
yeah.
Okay.
Senator Boquist, are you going to do, which one?
823.
Okay.
I'm still waiting for the diagnostic.
Well, Senator
Okay, so I could go.
Senator Boquist, you can really clear out a room, you know that?
Done. This one's done.
Done. This one's a big list.
This one is?
Yeah, let's open this and we'll call Courtney.
Okay, I'm going to open a public hearing on Senate Bill 823, and hopefully Senator Courtney will get down here.
He was here just a
He
minute
was
ago.
here.
Yeah.
I saw
Be
him.
the right. He's going to be the left.
So let's just stand at recess.
I'm Senator Courtney.
No.
Can we
You
stand at
dress better
recess
than him.
until
Don't
Senator
let him
Courtney
hear that
gets
I
here?
said that.
We're in a public hearing for Senate Bill 823.
Or do we want to do them both together?
Senator Boquist.
Thank you.
Yes.
Thank you, Madam Chair, members of the committee. I am Brian Boquist, State Senator, District 12, here with my good colleague from across the aisle, Senator Courtney, on Senate Bill 823. I will first start off by apologizing. I know that several members of this committee have seen the draft work group or the draft documents that the good senator and I have been working through on a means of improving the state's mental health care system over a 2 to 6 year period of time. It is a work in progress at this time. I think I am scheduled to meet with several of you, all three members who are every other one up there. How appropriate. Later on with Senator Courtney in regards to this, we've been working at this, I think, since January together. It's been a bipartisan effort involving multiple senators on both sides of the aisle. We have indulged the state's time, and we have beat Ms. Hammond about the head and shoulders to come up with some futuristic plans and some things that most people would not think common here, because there are some new programs that we're going to end up addressing in the in-state of 823, which will probably, of course, be much different than it is right now. With that, I think I'm going to turn it over to Senator Courtney, who has, it looks like, 2, 4, 6, 7, 8 pages of notes.
Thank you, Senator Boquist. My name is Peter Courtney, and I'm a state senator, District 11, which includes portions of Salem and Jers and Woodburn. Chair Mona Anderson, Vice Chair Cruz, members of the committee. He was recently in a meeting just an hour ago where there was nothing but Democrats in it. And there was a very young group, and they asked me, because I've been here so long, can you pick the greatest legislative moment in your career in terms of a piece of legislation? I said, I just, maybe it's a memory issue because I'm so old. I said, I can't. But I said, but what I do recall is I was allowed to have maybe 1 or 2 or 3 moments of pure joy. And it was a situation where all of a sudden Democrat, Republican didn't matter. And you came together in a way that you were fiercely defensive of your brother or sister. And all I'm going to say is I'm an accidental mental health advocate. And it started back in 2005 when, you know, and some of you have heard this, and so I'm going to rush this testimony because I'm going to let Linda speak. When I accidentally, it was a cold day, it was a rainy day, went to the state hospital with then Karen Minnis, Speaker of the House, who is very Republican, very conservative, very much different than I am, at least in terms of how people's perception. And we went out there, and because we discovered a nightmare of nightmares in the room of lost souls, the cremains, you all know the history, you could just tell without even making eye contact, because we couldn't speak to each other for 2 days afterwards, nor could anyone else in that when we went out there, that all of a sudden nothing mattered. We were going to build a new hospital. There weren't going to be any deals made. There wasn't going to be any Democrat or Republicans. It wasn't going to be any rural, urban. We were going to get the job done. And I was as powerfully defensive of her and her back as anybody could be on that project, and she of mine. And to this day, it's one of my greatest moments that that's how I operated. I'm on the, perhaps on the verge of having it happen again in my life with the good Senator Brian Boquist. Clearly, he's a different personality than I am. He's rural Oregon. He's a conservative Republican. He's everything that I'm not in a lot of ways. But somehow or other, we're here together about something that's, again, for me, accidental. It's mental health. And I'm not going to go into the extent of the study, except to point out that one of my fellow senators said something to me recently. Yes, Peter, I want to help in mental health, but just not now. And that is the reason that hospital ended up in that condition. The reason I'm accidental this time, last time it was the room of lost souls. This time it was because, and you know I've said this before and Brian's heard this, when Sandy Hook happened, I remember we were here together, don't you remember? That was December 18th. We were having a special session. Yep. Some of you, Senator Knope, you were not here yet. You were going to be here. Everyone else was here during that special session, and the news came from that terrible tragedy. And all of a sudden, I thought, over the days and weeks since then, I thought, it just seemed to me our country was at battle over guns. Guns, 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 guns. I'm tired of hearing about guns. And every time they talked about guns, they ended up saying, and by the way, we should do something about mental health. You know, mental health was, you know, every group, whether regardless of which side, mental health, mental health. And I just got mad and said, all right, I've had enough. We're going to do something about mental health. We're not going to do something about mental health, Senator Boquist, not just because of Sandy Hook. Oh, no, no. You know, what about this whole criminal justice thing we're talking about? You know, what about people just living everyday lives? What about the number of people who are in this room today that wouldn't want to talk about it that have mental illness in their families or with their friends? If you knew some of the people that serve with you that have mental illness problems that I'm aware of, you would be stunned. You would be stunned. The most stunning interview I've ever had was when I had a press availability on this, and we were through. Everybody waited to leave except for one major editorial writer in the state. He said, Peter, can I ask you a question? Are you mentally ill? And, you know, it might sound funny, and I dropped my, no, not that I know of. I've not been diagnosed. He said, well, I am mentally ill. I'm bipolar. My son's bipolar. And he's crying. He was crying. He's a hardcore editorial writer. He was crying. Well, what Senator Boquist and I are trying to do is develop a statewide approach. And the specifics are horrific. I'm just going to give you one program, and then I'm going to turn it over to Linda, because I think it underscores something about the magnitude of what I'm talking about. And Senator Brian Boquist is ahead of me. He's ahead of me on this because I haven't been able to go to my caucus yet. I haven't even been able to go to my caucus yet. And it's killing me. He's gone to his caucus, which in a way I'm glad. I'd like to go to he and I would like to go to every caucus in this building. He and I would like to make this pitch as we could, because if it's Democrat, Republican, stop it right here. Don't do another thing. If it's rural, urban, stop it right here. Don't do another thing. Don't. Because as you're going to see, the one program that I'm trying to find here, it's called the ESA program. Now, all you know about the ESA program, right? Well, I didn't know about the ESA program. I'm still learning about the ESA program. In fact, I'm still learning what I'm promoting. I don't even understand the magnitude of this bill. You all do, because you're all in this committee. ESA. ESA is a program where it provides, here's the thing. I'm just going to give it, for example, here we have it. Josh, a 14-year-old boy, sees his primary care doctor, confides that he's hearing voices, and he's scared. He's scared. The doctor can make one phone call, and within 24 hours, each team member will connect with the patient's family to get Josh counseling, medication, and peer support. Basically, it's a SWAT team of mental health people that move in just like that when that call is made to help that kid. The family will also be assisted with how to best interact with Josh to help him cope and get back to health. Well, that's interesting about ESA. Here's the number of kids. Right here, and you can't see it. Well, maybe you can. This is the number of county where ESA is. It's 15 counties. We have 36 counties in our state. It doesn't exist in counties like Baker, Joseph, Wheeler, Crook, Harney, Douglas, Lincoln. It doesn't exist. Which means kids in those areas, just at the ESA program, kids in those areas, their parents have to get them in the car, and they have to drive for hours, maybe through the nights, to get to the valley, someplace to get help. Or the children in eastern Oregon or on the coast or in the southern part of the state, do they suffer any less because they're not in the valley? How come the kids in the valley, and I'm from the valley, I want my kids taken care of, but I want your kids taken care of, and I want the kids across the state. Just ESA alone. If we fully implemented ESA alone, the impact would be incredible. But that's just the beginning of the programs. And I'm not making this up. So it's very simple. I'm really honored. I wanted Senator Brian Boquist to go first. I wanted him to speak first. I want to be associated with him on this and with Linda Hammond. Because when it's all said and done, either we're in this together or it cannot happen. And so I really thank you, Chair, Lori Monis Anderson, for letting us talk about this. This is the first time we've had this presentation since we stumbled on it in our own sort of way back in February, and he and I found each other in the night. I don't know what brings Brian to this. I told you what brought me to it. I've never asked him, Brian, why are you so interested in this? Why are you so interested? It's strange. Strange, I will tell you. The number of lives that are affected by mental illness is unbelievable. Now I'm going to give you one thing. Remember when that told you that editorial writer asked me if I had mental health? You know what I did? I jumped. I said, no. And then I said, Peter, why did you jump and say no? Do you know why I jumped and drew back and said no? There was only 2 people in the room. Why did I do that? Stigma. It occurred to me, the stigma. Oh, well, I don't know. Did you know? It was stigma that made me jump. And I'm supposed to know it'll be cool, right? I'm supposed to not have stigma. It was stigma that made me jump in front of him. Then I said, Peter, there it is. The stigma of mental health. You don't, no, I don't, no, I'm not, I've never diagnosed. You know? If you'd asked me if I had, you know, have you had a cancer or some other physical ailment, I don't think I jumped. I said, well, no, I've never had that. But not when he asked me about mental illness. That was very revealing to me, very powerful statement to me, that this stigma thing is as much of a problem. And the only way we can deal with it is if we develop this statewide program now. No other state's trying to do what we're trying to do. No other state is trying to do. No other state has the state hospital that we now have. No other state. But that's just the state hospital. We're not touching 45% of the young people in this state. There's all that we're touching in dealing with their mental health. Excuse me, 35. You're touching 45% of the adults. You're only getting to 35% of the kids in this state that need mental health services, and 45% of the adults. Isn't it interesting? We're getting more of the adults than we are the kids. That's all. So I will beg you to at least to at least look at this, because individually and collectively, this is where the power is in this committee. If this committee will take this on, then I can tell you, we got a chance. We got a shot, I think, at really breaking through on this. So again, I feel strongly about it. I am an accidental mental health advocate. I don't have your training. I don't have your smarts. I'm still learning what's in this bill. I still don't even know the magnitude of this bill. I know what there's charts, there's visual aids. We have an expert here like no other in the nation. She is the guru behind the state hospital. So with that, Chair, if I would, I'd like to turn it over to Linda Hammond and have her start to go into details. And I know that you've heard some of this. Of course, Senator Hayward has heard some of it, Senator Knopp has heard some of it, Senator Cruz has heard it. Senator Shields, you have not, unfortunately. I mean, I must say that to you. I'm not picking on you. It's just that I have not gone before the Senate Democratic Caucus yet. The others have had some part of this. But, Senator, you haven't even heard of it. I don't think have heard the magnitude of what she's going to talk about. So thank you.
Chairman Sanderson, members of the committee, for the record, my name is Linda Hammond, and I'm the Interim Director for Addictions and Mental Health. What you have before you in Senate Bill 823 is not just something that we come to quickly or lightly. When I was asked by Senator Courtney and then by Senator Bates to look at what's needed in the mental health...
Boquist, wasn't it? Was it Boquist or Bates?
Excuse me, Boquist.
Yes,
I'm sorry.
please. Jeez, it's my brother. It's my brother. My brother. Don't do that to my brother. My wingman.
All those B names, we got a lot of those in the Senate.
We know you're under pressure.
I don't know why. When I came to this and was asked to put this together by the two senators, I went back to work that has been going on for a long time. As Senator Courtney said, I was involved from the beginning of the concept with the State Hospital Replacement Project. And back when we did the master plan, we recognized at that point there needed to be a significant investment in community mental health. We called together a community services work group of many members across the entire state, and we asked the question what needed to be how did we need to reinvest, what did we need to improve, and that's back as early as the work beginning in 2005. And as of this time, we've made very limited investments in those areas that were recognized. And while we've seen this great move forward with the improvement at the state hospital, we have not seen the same growth in our community mental health system. We've been struggling to maintain the status quo, in many cases woefully falling short because of both the increase in population but also the increase in costs, which we are again trying to manage through various mechanisms. And what this bill presents to you is a whole strategy across the spectrum of education and working with our communities to talk with parents, talk with schools, talk with our physicians and work with them and support them to helping support mental health amongst our children. It also works with our system for adults, which we know has been struggling under many challenges, including the need for housing, for peer support services, for additional wraparound services that really help people when they're struggling with mental health. We know that the only solution is not a medical solution, but we need to support medical solutions with other types of services that help people really navigate the system and be successful in their own homes. We've continued to work on our AIM High area and make sure that people are moving as quickly through the system and having a key to their own front door. And the components of this bill before you are grouped, and they're grouped in a way to look at 0 to 25. But then we also have pulled out some specific programs that are specific to adolescent ages, which again go from 18 to 25, and cross multiple types of age groups. And then we also have an area that focuses in on adults and also on seniors, because all of these populations have suffered from this lack of funding, this equal opportunity to receive mental health care how they need it in their own communities and make them more successful, in many cases keeping them out of the system altogether so they don't end up in our jails and in our hospitals, and also helping them, should they get there, to quickly become viable parts of their community again, which is what they want. And there are many facets of this bill. For our young adults programs, where Senator Courtney has talked about ESA, and then we have the young adult community hubs which build upon the ESA program. That's a new program. The young adult support groups, these bolster our youth who really need those connections that they can't get. And I could go through the list. I have 2 pages here of the list of all the different facets of the bill. But I can assure you that each one of them was carefully thought about, was looked at in a way by the Community Services Work Group in the large conceptual way, and then by the agency in a way of how do we implement this in a timely manner, in a phased approach that really gets us to the point of having a fully funded system, while we're also thinking about the implementation of the CCOs and how we connect with physical and mental health together to ensure we're maximizing our federal dollars and making sure we're getting the connection so that we ensure that folks are not only mentally healthy, but they're physically healthy as well. And making sure we maximize on other dollars, such as the Medicaid expansion and other service dollars as they come along. We need to be ensure we're being good stewards of state money as we do that. We also need to be accountable. We need to put in a system that can assure you that we're really achieving that work, and we're achieving it locally with local involvement, but with various assurances that we're using evidence-based practices and we're using approaches that really can move the system in a thoughtful manner. I'm happy to answer any questions on the details of the bill if you have any specifics.
Specifically, is it a